I always wanted to be a doctor. I went into medical school thinking I would be a general pediatrician, but early on I had a number of influences that led me towards surgery and quickly recognized that breast surgical oncology was what I wanted to spend my life doing. I'm a fellowship-trained breast surgeon, and I did my breast fellowship with Armando Giuliano, a famous breast surgeon who dedicated his life's work to defeating breast cancer but keeping women whole. And I think about his influence every day. He's this very charismatic, the kind of definition of the surgical scientist, very passionate about what he does, and he's transformed the field. And it is something where, when I'm operating, I hear his voice in my head. But the fellowship was an incredible opportunity to focus not only on the surgical techniques, the latest research in breast cancer. It just was very comprehensively satisfying to see all those steps that women go through in their treatment of their breast cancer. So I'm deeply indebted to him. My practice is devoted entirely to the surgical management of breast disease. So the majority of that does end up being breast cancer, but there are benign indications for surgical intervention in the breast. When women come in with a diagnosis of breast cancer, they're understandably frequently very anxious, very frightened, because they don't want cancer to change them. And I understand that. There's a lot of different ways that you can manage breast cancer that have equivalent outcomes, but it really does allow you to choose the treatment that's best for the individual in front of you. The other thing that I love about treating primarily breast cancer is that for the vast majority of my patients, I'm able to tell them that at the end of their treatment, we expect them to be cured of their cancer. And most of the modern advancements in surgical management of breast cancer have been focusing on where we can safely do less. And that's huge. That's not work, that is truly a privilege. And I love what I do every day.